This presentation was made at Miami University in 2020 and provides an overview of the lack of education on physical activity in medical school, physician's assistant, and nursing curriculums. If exercise is medicine, where is the education on how exercise is medicine?
Exercise has been proven to be an effective way to prevent the development and progression of chronic disease. Some of these diseases include, but are not limited to, metabolic diseases such as type 2 diabetes, heart and pulmonary diseases such as COPD and chronic heart failure, and muscle, bone, and joint diseases such as osteoporosis. Physical activity has also been shown to reduce anxiety and depression in individuals who exercise regularly. The image to the left demonstrates healthy, dense bone tissue on the right compared to the much weaker bone tissue on the left. This bone is representative of someone who has osteoporosis, a condition that can arise from a lack of physical activity. The reduced mass and density of the bones makes them weaker and more prone to damage, which can cause chronic pain. The image to the right shows one of many possible effects of coronary heart disease on the body. Atherosclerosis occurs when fatty plaque builds up along the walls of the arteries, creating decreased blood flow and hardened arteries. Over time, this condition can lead to increased risk of heart attack and stroke. However, someone's chances of developing coronary heart disease are greatly reduced with regular exercise.
You might be wondering, how does this really have any effect on me? I doubt I'll end up being that physically inactive to develop any of those chronic diseases. But actually, a current event that is very relevant to you is COVID-19, which through many studies has been shown to be more severe to people with heart problems, and your risk of heart problems also increases if you get the disease. On the previous slide, we discussed how being physically active can reduce your risk of heart diseases, which also means it will combat the negative effects of contracting COVID. If you're wondering how you can stay active during the pandemic, the image below suggests ways such as dancing, strength and balance exercises, or playing active video games. Also, physical activity can help students in other relevant and immediate ways. We just discussed how physical activity can help with someone's mental health. We all know how stressful being a college student can be and the toll it takes on your mind. But now we also know how physical activity can help counter those negative outcomes. On the picture to the right, you can see some effects of physical activity are lifting your self-esteem, improvement of your mood, a lowered risk of anxiety and depression, and a reduction of stress.
So next we're going to talk about physicians programs. Recent research has shown that over half of the doctors trained in the United States weren't provided with official exercise or physical activity education in medical school. You can think of this in the sense that over half of our future doctors are less capable of understanding and diagnosing their patients' physical activity problems. Without this knowledge in med school, our future physicians are missing out on a crucial form of contemporary medicine that could benefit their patients. This contemporary medicine is also known as functional medicine or holistic healing, and this includes a focus on exercise and lifestyle choices as depicted in the infographic on the right. When you go to a doctor appointment and they ask, hey, how much do you exercise? They should have background information on why that exercise is so important. And when a physical therapist or an occupational therapist is working alongside of physicians, it can be frustrating to have different background knowledge about exercise prescription. In a related profession, physician's assistant programs are also typically missing formal exercise education. These programs usually include a physical diagnosis course, such as Principles of Physical Diagnosis, as shown in the photo on the left, where a student is conducting a physical examination on a pretend patient. This type of physical examination course is helpful in addressing the physical symptoms of the patient. However, this course, just like other courses in physician's assistant curriculums, fails to include the ways to prescribe patients with exercise, in addition to or instead of just prescribing medication. Without in-depth courses for students regarding the health benefits of physical activity, physician's assistants won't feel confident in their assessment and diagnosis of a patient's physical activity and lifestyle in their future careers.
Nursing programs are another area that suffers from a lack of physical activity-related coursework. The general curriculum for nursing programs includes anatomy and physiology courses, general science such as chemistry and biology, a statistics and medical math class, nutrition and diet class, and nursing-specific coursework. In this standard list of coursework, there is no mention of a physical activity-related course. To further this point, I looked at the curriculum within Miami University's own nursing program. The coursework I found was very similar to the general curriculum outlined before, with no mention of a physical activity related course. This is especially alarming considering the information presented in the previous slides. Additionally, a growing number of nurses are becoming nurse practitioners, with the field projected to grow by around 45% by 2029. With an increased focus on nurse practitioners as primary care providers, it is disheartening to see that they won't be equipped with the full knowledge required to aid in the treatment of patients. The good news for the field, though, is that the implementation of exercise training in nursing programs seems to be trending in the right direction. In 2018, Exercise is Medicine paired with the American Association of Nurse Practitioners, a large contributor to the continuing education in nurse practitioners.
As we have just discussed, it is very evident that the amount of actual physical activity that medical students are exposed to is rather small. In fact, only 6% of U.S. med schools had a core exercise course requirement in 2002. We also discussed how for many occupations and majors, it is very important to have experience in actually being active and learning the benefits of it firsthand. Whether it is through your school program or your own volition, it is crucial that these students understand and learn the advantages of being active for their own and their patients' sake. The importance has started to be realized because the actual percentage of institutions that offer some sort of coursework in physical activity education seems to be at an all-time high, at least when compared to other studies. For example, the percentage of institutions that offer at least one course about physical activity education is 17.8%. A great example of this educational improvement is seen with the University of South Carolina School of Medicine, Greenville. This medical program is one of the few institutions that has provided a formal exercise education in all 4 years of their med students' curriculums. In fact, their senior graduating class in 2019 had a 100% residency placement rate, and with this formal exercise background, their future physicians will be able to assess, prescribe, counsel, and model physical activity behaviors and strategies to improve their patients' life quality and health outlooks.
Because regular exercise can prevent the onset of chronic diseases as well as improve symptoms of pre-existing conditions, it is important that healthcare professionals are educated on physical activity. Currently, education for physicians, physician's assistants, and nurses lack emphasis on the importance of exercise as a treatment or preventative measure for chronic illnesses. However, exercise education is improving and will hopefully continue to for future healthcare workers.